Hello everyone, we're gonna start with our topic, and today's topic is about diabetes. Mostly of us, we already know what is diabetes because we hear it in our family, in our friends, or we know someone who has diabetes. But do we know what is exactly diabetes? We want to start with the question, what is diabetes? Okay, diabetes is a disease that affects how our body uses blood sugar or glucose. So in our body we have the pancreas, and in the pancreas we have an hormone called insulin. So this insulin is the key that allows sugar enter in your cells, and we can have energy to do our activities. About 34.2 million people, all ages, or 10.5% of the US population, have diabetes. The percentage of adults with diabetes increased with age, reaching 26.8 among those aged 65 years or older. Exist three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes. Insulin-producing beta cells in the pancreas are mistakenly destroyed by the body's immune system. So we don't know exactly what is the cause of this type of diabetes, and here are an image that represents what is the process and what is this type of diabetes. So stomach converts food to glucose, then glucose enters bloodstream, then pancreas produces little or no insulin, and glucose unable to enter body effectively, so our glucose levels increase. The signs and symptoms of this type of diabetes is frequent urination, increased thirsty, dry mouth, itchy or dry skin, increased appetite, unexplained weight loss, and gas infections. Type 2 diabetes, this is a metabolic disorder in which a person's body still produces insulin but is unable to use it effectively. So we have an image 2 that we can look at, and this part stomach converts fluid to glucose, then glucose enters bloodstream, pancreas produces insulin but the body cannot use it efficiently, then glucose unable to enter the body effectively, and of course glucose levels increase. The signs and symptoms of this type of diabetes is you feel thirstier than usual, you're hungry even after you've been eating, you're tired all the time, you're taking more bathroom breaks, you feel tingling in your hands and feet, your infections or sores heal slowly, your vision loss seems blurry, and your skin like neck, arms, or breast is darkening. There are many risk factors related with diabetes. One of those are smoking. There is 21.6% were tobacco users based on self-report or levels of serotonin, and 50.0% report currently cigarette smoking. So other factors are overweight and obesity, physical inactivity, high blood pressure, high cholesterol. In type 1 diabetes, is most common when you're a child or teenager, and also a risk factor is that you have a parent or sibling with the condition. And the type 2 diabetes, the risk for type 2 is those people who are overweight, who are age 45 or older, have parent or sibling with the condition, and or maybe that they have had gestational diabetes or have pre-diabetes. and we going to the other type of diabetes, and this one is gestational diabetes. This type of diabetes is only seen in pregnancy. And during pregnancy, the blood sugar levels become high, and this disease affects up to 10% of women in the United States each year. This disease goes away when you give a birth. In this disease, the baby can be overweight due to the glucose levels and exist many complications. They can be heart disease, heart attack, stroke, neuropathy, nephropathy, retinopathy, and vision loss, hearing loss, food damage such as infection and sores that don't heal, skin conditions such as bacterial and fungal infection, depression, dementia. In the gestational diabetes, the complication can be premature birth, higher than normal weight birth, what RSA, and also an increase of type 2 diabetes later in life. That also can be low blood sugar. The treatment of diabetes, there are different medications. Some of these drugs are taken by mouth, while others are available as injections. I think the main treatment is insulin for type 1 diabetes, because it replaces the hormone your body isn't able to produce. For type 2 diabetes, it can be diet and exercise that can help some people manage type 2 diabetes. And also the main thing is a lifestyle change. We need to eat more healthy, we need to do exercise at least 30 minutes per day. And we need to check our blood sugar level frequently and see our doctor. So I encourage you to see a doctor to check your blood sugar levels and to improve your lifestyle. So this is my presentation. Hopefully this will help you to understand more about diabetes, and if you are not doing well, you can change now. It's not too late to improve your health and to prevent diabetes. And thank you for your participation.